Hello everyone, this is SPN Kumar. So last session we are discussing about novel drug delivery systems. We have seen several approaches like mucoadhesive drug delivery system. So today's session we are going to discuss one more type of novel drug delivery, that is implants. So today's topic of discussion is about implantable drug delivery system. So what are these implants and how they are helpful in the delivery of drugs for the patients. So let us see. So what do you mean by implants? So implants are small sterile solid masses, so which are consisting of drugs and they are released slowly into the systemic circulation. So these provide a controlled delivery of drugs. So what the implant means is, so the implants can be first classified as bioerodible and non-bioerodible. Some implants, they are erodible. Once they are entering into the body, our body's fluids and the enzymes, they will completely disintegrate the systems, whereas some, they are non-erodible. They are not metabolized by the body systems. They will be remaining intact and they have to be removed by surgical incision. So an implant is instilled into the body. So this is a special syringe. So an implant is instilled into the body with the help of a special syringe, such that it is placed inside of the body cavity. So once it is placed in the body cavity, from there, from that region, the drug is slowly released into the local tissues. So this type of drug delivery is especially helpful for local treatment rather than systemic treatment. Suppose there is a condition, local condition, there is some inflammation or there is some damage, we can remove or we can produce therapeutic benefit by using these implants. So they provide a very controlled drug delivery. Since the polymers utilized here, they have a good hydrophily lipophily balance, they are going to release slowly in a zero order manner, such that the drug will be slowly released into the systemic circulation. So the implants are intended, so what is their main purpose? Their main purpose is implantation in the body. The word implant is for this terminology because they can be used for implantation in the body cavity. Especially they are given subcutaneously. Suppose there is a protein drug like insulin, or there is some peptide drug which is otherwise difficult to give it by oral route because it undergoes hydrolysis. We can use this implantation, you can use this implant to directly release into the cavity, from where it will be absorbed into the systemic capillaries. So implants are administered by means of suitable special injection. So we can use an injection as we have seen in the previous slide. We can use a special syringe, or we can make a surgical incision. So we'll choose one site of skin like underarms or back dorsal side of the abdomen, so where a surgical incision is given, into which this implant will be administered. These are developed with a view to transmit drugs and fluids into the bloodstream without repeated insertion. So the main purpose is, if you are giving a tablet or an injection, for every 4 hours or 6 hours, they need to be given repeatedly to have that effect between minimum effective concentration and maximum safe concentration. In order to maintain that flat line between the minimum effective concentration and maximum safe concentration, the drug needs to be given repeatedly. But implants, since they are inserted into the body cavities, they will undergo slow dissolution in the tissue fluids and you can have a better control of the drug delivery. So these systems are particularly suited for drugs such as insulin. Why insulin? Insulin is a peptide, polypeptide consisting of 51 amino acids. If this is given by oral route, the gastric enzymes are going to hydrolyze that insulin. So hence, better way to give insulin is by implantation system, such that it will be directly administered into the subcutaneous cavity, from where it will be slowly released. So patient will feel the pain only once and you can have that insulin release for days. So we can avoid the invasive procedure several times by using these implants. Steroids are very large macromolecules, hence it is preferable if you give any steroidal hormones like progesterone, estrogen, especially contraceptives, they are given by implantation route. So once given, they can act for 3 months or for 6 months and have their oral contraceptive activity. And some antibiotics, some large scale peptides, large molecules, or even painkillers are also given by this route. So there are also other examples like heparin, they are also given by this route. So basically, depending upon the construction, implants can be classified as biodegradable and non-biodegradable. What do you mean by biodegradable? So they are completely corroded, or they're completely hydrolyzed in the body. They are biodegradable. So in our body they undergo dissolution, they will merge with the body tissues, whereas this one they do not merge, so they have to be removed. So once their therapeutic action, these do not merge and they have to be removed. So after their effect is done, they have to be removed by surgical incision. Those are non-biodegradable systems. So what are the advantages of having implants? So advantages are unattended continuous delivery. If you are giving a tablet, every time you need to be beside the patient, but this one is unattended. Once it is administered, we can forget about the implant. It is going to do its job, slowly release the drug into the systemic circulation. It avoids the high variability in peak and trough concentration. So if there is a tablet, let's plot a graph between time and concentration. Suppose the T half of the tablet is 2 hours, so for every 4 hours the tablet needs to be given. So the tablet concentration will fall down. Again second dose, so here at the 4th hour we are going to give second dose of the tablet, so again the concentration is going to, so we'll have a crest and trough if you are giving a tablet which is having multiple dosage regimen. But if you are giving an implant, so let us see the line for implant. So implant will be having a flat line. Once it is released, it is going to slowly release the drug in between the minimum effective concentration and maximum safe concentration. So this blue line refers to the implant and the crest and trough refers to the tablet. So by this we can clearly say that implants are more advantageous, having less variability in peak and trough concentration. So this peak and trough are not present for implants. So they have better drug efficacy. Since the drug is directly administered into the body cavity, there is no drug loss. From there the drug will be slowly dissoluted, you will have a better action. So it is having minimized side effects. So suppose your drug is a local drug, since you are giving it in a particular site, there is no chance of adverse effects. The drug will be released only in that region but not in the other areas, which will avoid or prevent the propensity of side effects. So termination of therapy as and when required. Suppose for some strange reason, if the drug is reaching a level more than the maximum safe concentration, it may result in adverse effect. Suppose you have a doubt, suspicion that the tablet is going to cause adverse effects, immediately we can remove that implant either surgically or by making an incision. We can remove that implant. So your drug will immediately fall in its concentration, so it can be easily removed. That's what this point says. So patient compliance is also a benefit, since we are giving the drug only once and we are forgetting about the next administration or dosage regimen. Since there is an unattended drug delivery, it promotes the patient compliance. The patient feels comfort, since he will do it once and he will forget for the other times of the day or other times of the week. So one dose will be sufficient for more number of days. So that is one more advantage. So what are the disadvantages? So implants, they are also associated with some disadvantages. There is a chance of hypersensitivity. So whatever the drug is there, the drug should be compatible with the body fluids. If the pH or if the reactivity of the substance, hypersensitivity, if the pH or the compatibility of the drug is not adjusted, so it may cause reactions, allergic reactions, or it may cause local reactions like flush, flare and wheal. So we can have this flare, wheal, local sensitization, redness, erythema, etc. may be present in the area. So implantation procedure is difficult in the case of a larger implant. So this holds good if your implant is small in size. Imagine an implant which is more than 1 inch of the size. So it is obviously going to cause some disturbances in the body. So it is also very difficult to administer discomfort to the patient. So inadequate drug release. Sometimes if the system is not properly designed, the drug will stay inside of that implant, that core material, and it is not going to come outside. So it may result in inadequate drug release. So requires a small surgery for large implantation, also painful. So sometimes we need to perform a small surgery if the implant size is more than that 1 inch of size. which causes discomfort to the patient. It is always an invasive procedure, is always a painful procedure. So the disadvantages associated. Now you know what is implant now and what are the advantages. Now let us see how they are prepared. So they are prepared by either of the following methods. What are they? Either they are prepared by compression. See, just like how a tablet is prepared, we'll take all the drug, we'll take all the excipients, we will compress them into a small tablet. It can be prepared by compression to make a compact solid mass, or they can be prepared by molding technique. So where your drug in liquid form, excipient in liquid form are going to be placed into the mold, where we are going to use some congealing method such that this liquid material is undergoing solidification. So once it is solidified, it assumes the shape of the mold. So molding, compression, two methods. The third method is extrusion. So nowadays this extrusion method is being popular. So what is extrusion? So we are going to take our drug and excipient mixture in a semi-solid form which is having a mobility of consistency. So this is passed to a extrusion apparatus. There is one extrusion apparatus from which the mixture is going to be passed out as long elongated pieces of mixture. So this one can then be sloughed off to become small pellets, to make small pellets. So implants can be prepared by compression, just like tablets, direct compression, or we can use molding technique, MOULDING, molding technique, where the liquid material is solidified and assumes the shape of the mold, whatever the shape we have given to the mold. And we can also use extrusion method, where forcefully the drug excipient mixture is passed through a fine pore where an elongated mass is extruded out of the machine. So this then can be sloughed off to get the extruded particles. So that is the method of preparation. Now, depending on how they function, the implants can be classified as rate programmed drug delivery systems, activation modulated drug delivery systems, in which there are again subtypes. So there is also controlled drug delivery, feedback regulated process. So there are the main classifications and sub ramifications. Let us see one by one. So first one is rate programmed. So what do you mean by rate programmed? So rate programmed depends on two principles. Either we can control diffusion or we can control dissolution. So what we are going to do is, we are going to use a polymer in combination, in conjunction with the drug, such that the drug is not released immediately into the systemic circulation. So in these systems, either the diffusion or the dissolution of the drug is interrupted, such that the drug will be slowly and steadily released into the systemic circulation, such that there will be a longer effect when compared to the other dosage form. So what is a polymer membrane permeation control drug delivery system? So as you can see in the diagram, so there is a drug reservoir. So whatever the drug material is there, it is encapsulated or unbounded with the help of a polymer membrane. Suppose the drug is hydrophilic in nature, you are going to choose a polymer which is lipophilic in nature. So due to this different combination, hydrophilicity and lipophilicity, the drug will be slowly diffusing out of this system. So you can obtain a zero order drug release. So a long drug release can be obtained. So what are the examples of the systems which are employing this technique? Norplant subdermal implant. So Norplant is using norprogesterone, which is an oral contraceptive. We can use this as an implant and we can avoid the inconvenience associated with administration. Once it is administered into the woman's body, it can act for a period of 3 months or 6 months and can provide the contraception effect. And progesterone, it is also an oral contraceptive, and this is a special one. So suppose a patient is suffering with glaucoma. Glaucoma is characterized by increased intraocular tension. Then we can use this Ocuset system, which contains the drug pilocarpine, which will reduce the production of aqueous humor. Then the patient's intraocular tension will come down and you will have the therapeutic relief. So this is a special one to release this pilocarpine drug delivery, which is inserted into the cul-de-sac cavity of the eye. So the other one is polymer matrix diffusion system. So previously we had a polymeric membrane inside which drug core is present. So let us imagine that there is some damage. Let us suppose that there is damage to this polymer. So then what happens? All the drug will be immediately released into the systemic circulation, which is called as dose dumping. Dose dumping is very dangerous. Why? Because due to the dose dumping, more dose enters into the systemic circulation, and which leads to higher adverse effects. So in order to avoid the adverse effects, drug has to be released slowly but not suddenly. So how can you achieve that? You can achieve that by using a polymeric matrix, where each drug molecule is dispersed between the polymeric molecules. So now each drug molecule is surrounded by a mesh of the polymer. Even though there is a damage to the polymer, only one mesh will be ruptured, only one molecule will be coming outside, but there is no sudden release of drug into systemic circulation. So dose dumping is not associated with this polymer matrix diffusion controlled system. So there is this drug, and you have that encapsulation, matrix encapsulation. So once the matrix is slowly corroding, drug will be slowly released. So the polymer will absorb water from the fluids, from the tissue fluids. It will swell. So due to the swelling, drug will be slowly released into the systemic circulation. Next, there is also a hybrid system. So membrane matrix hybrid type of drug delivery system. You know, hybrid means a combination. Combination of what? A combination of reservoir plus combination of matrix. So what we are going to do now is, we are going to take the drug and we are going to disperse in the polymeric matrix. So each drug is surrounded by number of polymeric meshes, and outside there is also a polymeric membrane, just like a reservoir system. So the disadvantages associated with the reservoir and disadvantages associated with this matrix system will be culminated, will have a better release by using this hybrid system. So examples of drug using this system is Norplant 2 subdermal implant, which consists of the hormone levonorgestrel, which is also an oral contraceptive. So by now you would have understood one of the applications for implant is oral contraception. It is mostly nowadays also in the market, oral contraceptives are being marketed as implants. So apart from diffusion and dissolution control systems, there are also activation modulated drug delivery systems in the implant. So what are they? So we can use some external pressure to have the drug released into the systemic circulation. So that external pressure can be an osmotic pressure or vapor pressure or magnetic force or some battery operated electrical stimulus. So let us see one by one. So the first one is osmotic pressure. We'll be having one example here. So this one is the Aljet osmotic pump, Aljet osmotic implant. So where there is a semi-permeable membrane. So this implant is made up of semi-permeable membrane. So once it is entered into the body cavities, the body fluids will enter by osmosis. Since this is a semi-permeable membrane, the solute molecules will travel from low concentration to high concentrations. Here it is enriched with an osmogent like NaCl or magnesium sulfate. So since the solute molecules, water molecules, are traveling from low concentration region to high concentration region, inside the osmotic pressure will be increasing. So what we are going to do is, we are going to design this implant in a way that this shell is very rigid. The shell which is enveloping this osmogent layer is very rigid. So your increased osmotic pressure will cause swelling in this osmogent layer. So above we will be having drug reservoir, we will be incorporating the drug reservoir. Since due to the increase in pressure, this chamber will be increasing in size. So due to the increase in size, it is going to push the drug outside of this implant. So slowly, the higher the number of water molecules are entering, higher will be the osmotic pressure, more will be the drug released out of this implant. So your drug has nowhere to go, it has to come outside through this laser drilled orifice. There is a miniature miniature hole which is created by laser. So it is a laser drilled orifice. So in this manner, by using osmotic pressure, so now we can call this as osmotic pressure activated implants. Activated drug delivery systems are activated implants. So a very better zero order drug release can be achieved by using this system. So osmotic, apart from osmotic pressure, we can also use vapor pressure as an activational force. So what is vapor pressure? So we are going to use a substance which easily vaporizes at body temperature. We know that our body temperature is 37 degrees centigrade. We can use a highly volatile material like liquid ether. So there are two compartments in this implant. One compartment, so suppose this is our implant, so one compartment it is consisting of ether, so the other compartment will have drug. So as soon as it is administered into the body cavity, ether will be volatilized, it will be evaporated. So that evaporated gas always has low density, it wants to escape, it wants to come outside, but we will enclose that ether layer below than this drug reservoir, such that this ether will push the drug outside of the implant. So ether, before it is coming out, it will push the drug outside of the implant and then comes out. So this facilitates the drug release. So here we are using vaporization as a force to deliver the drug. So hence it is vapor pressure activated drug. So this is the design of that system. So we have a vaporizable chamber, we have a drug reservoir. So as the ether is evaporating, the vapors generated, they have low density, they want to escape outside. So during that escape, there is this collapsible bellow. This bellow will push the drug slowly out of this laser drilled orifice. So we can achieve a better release. So one good example is administration of heparin. Suppose there is a patient who is post-operative condition. In order to avoid the deep vein thrombosis or pulmonary embolism, we can use this heparin via this vaporized implant to release the drug slowly into the circulation, such that after there is chance of deep vein thrombosis up to 72 hours post-operatively in the patient. So until that 72 hours, we can use this heparin implant to have a better release into the circulation. So that is 2, osmotic pressure activated, The third one is hydration activated drug delivery system. So as the name is suggesting, so we are going to use a polymer which is hydrophilic in nature, which can uptake water and swell 3 to 4 times than its original size. So this is, suppose it is 1 times, and this one is 2 times bigger than the first one. So it is going to intake the water, it is going to swell 2 times bigger than the first one. Slowly the drug is released into the systemic circulation, so where we can achieve a better control of drug release. So next one is hydrolysis activated. So hydrolysis activated, as you can see, this is a continuous system. Now what is hydrolysis? Hydrolysis is breaking up of substance by using water molecules. So this polymer will undergo disintegration in particular regions. So due to that disintegration, pores are formed. From these pores, the drug will be slowly released into the body cavity. So that is another kind of activation. So next is control. Last kind of systems is controlled drug delivery, where we can use a rate controlling membrane. So this rate controlling membrane will decide how much amount of drug is being released into the systemic circulation. So there are again 2 types. One is bioerosion, the other one is bioresponsive. Bioerosion is as soon as they reach the body cavity, they undergo erosion, slowly drug will be released. Bioresponsive is depending on the pH or depending upon the tissue environment, the polymer will behave. Suppose if you are using an acid resistant polymer, as long as it is in acidic environment, it won't release the drug, but once it enters into the intestinal environment, it is going to release the drug. So bioerosion regulated. So as we have said, there are 2. One is bioerosion. So this is the model for bioerosion. So we are using a polymer, so where we can utilize this system, enzymatic system, to break down the polymer and release the hydrocortisone directly into the body cavity. Or there are also other one, that is bioresponsive, where we can use, so this is one good example where insulin will be delivered from the implant if and only if the blood glucose is increasing. So the release of insulin is triggered by the increased blood glucose level. So hence you can call this as bioresponse. So depending on the response of the body, the feedback will be present. Hence it is a bioresponse. So nowadays it is widely being marketed for so what are the applications? So during our course of study we said that implants are mainly helpful for oral contraceptives. Other than that, it can also be used for cancer treatment. So the various cancers, they require better release of drug, otherwise there are higher chances of adverse effects. So hence for leukemia and for Hodgkin's lymphoma or prostate cancer, all these conditions, we require this implantable delivery such that the drug will be slowly released into the body. Osteoporosis, so this calcium deficiency related condition or hormonal due to the hormonal imbalance, this can also be controlled by using the implants. So ocular disease, as we have said in the previous example, pilocarpine or Ocuset systems are especially helpful for the patients suffering with glaucoma, and even retinitis can be cured by using these implants, where the implant will be placed in the cul-de-sac cavity of the eye. So contraceptives, we all seen these examples, levonorgestrel, progesterone, all these things can be given as a contraceptive implants to the women. So that's all about this implants. So implants will achieve a zero-order drug release. It is better for the patient, and even though it is painful, it is especially helpful for the delivery of proteins and steroidal hormones. So the next class we are going to see the other kind of novel drug delivery systems. Thank you all of you.